old but time-tested proverb, if the eyes are a window to the soul, then the mouth is the doorway to the body, reflects the importance of oral health. Medical books of ancient times have also stressed on oral hygiene and brushing of teeth with herbal sticks. The oldest form of tooth cleaning in the world is chewing stick. This form of tooth cleaning has been replaced with modern toothbrush and toothpaste. However, there have been some form of debate about the most effective tooth cleaning method between both, which led scientists into the study of both methods with some results. For thousands of years, long before the first toothbrush, people have used chewing sticks to clean their teeth and mouth. Chewing sticks originate from the roots, stems, and twigs of trees like guava, walnut, olive, bitter kola, and so on. It is grown naturally without the help of any artificial fertilizer, thereby rich with many minerals and antioxidants. The big question. Before giving a yes or a no for an answer, let's first take a look at the benefits chewing stick has to offer. Firstly, chewing sticks have been shown to contain major chemical agents found in modern toothpaste, such as fluoride, sodium bicarbonate, tannin, resins, and vitamin C, all of which reduce bacterial colonization in the mouth. It also contains minerals such as potassium, sodium hydrochloride, calcium oxides with whitening and strengthening properties for the enamel. It is then able to activate ptyalin, an enzyme in saliva that is useful in sanitizing the mouth and removing stains from teeth. It helps prevent the formation of cavities, plaque, and tartar. It removes coffee, smoke, and wine stains without being abrasive to the enamel. Chewing stick also sanitizes the mouth and freshens the breath in a single gesture. It whitens the teeth. It is a natural cleaning agent that has antibacterial properties that are able to prevent the proliferation of bacteria such as Streptococcus mutans, which is one of the causes of dental plaque and one of those responsible for the onset of caries and gingivitis. It is biodegradable and compostable, unlike common plastic brushes, because it is 100% natural. There is also a strong belief that claims that most old people who use this stick throughout their lifetime have stronger, whiter teeth. This is usually attributed to the fact that continuous chewing loosens and dislodges particles between the teeth, which in turn stimulates blood circulation in the gum. It is also very portable and dry, hence can be carried along during travel. To use this chewing stick, chew one of the two ends of the stick until the outermost part is removed. By continuing to chew, a structure similar to the bristles of the toothbrush forms, which allows the user to rub their teeth. When the natural bristles start to change color, which would happen after a couple of days, it is advisable to cut this piece of stick and repeat the process from the beginning. The miswak is predominant in Muslim inhabited areas. It is commonly used in the Arabian Peninsula, the Horn of Africa, North Africa, parts of the Sahel, the Indian subcontinent, and Central Asia. The miswak is a teeth cleaning twig made from the arak and mustard tree. It is an effective, inexpensive, and a natural toothbrush for teeth cleaning. A large number of studies has emphasized on miswak as effective or even superior to the present day's most common oral hygiene aid, that is toothbrush. The World Health Organization has also recommended and encouraged the use of miswak as an effective tool for oral hygiene. In the Islamic tradition, using miswak is a well-known sunnah of the Prophet Muhammad, peace be upon him, as per a report published in Saudi Medical Journal. Journal, a number of scientific studies have demonstrated that miswak possesses antibacterial, antifungal, antiviral, anticardiogenic, and anti-plaque properties. There is now increasing scientific evidence that miswak has medicinal properties that helps fight plaque, recession of gums, tooth decay, bleeding gums, strengthens the enamel in your teeth, deep periodontal pockets, and leaves you with a healthy mouth. To use a miswak, simply chew off about 1 centimeter of the twig at one end and then continue to chew it until it softens and forms bristles. The softening can be sped up by dipping the end in water to separate the fibers. Once bristles are formed, the miswak can be used like a regular toothbrush without paste. Now, the answer to the pondering question we all want to know: is the chewing stick really better than the toothbrush and toothpaste? According to the research published by the National Library of Medicine in the year 1989, titled Chewing Sticks vs. Toothbrushes in West Africa, a pilot study carried out by Norton et al., the research states that despite the fact that chewing sticks contain antimicrobial substances that could conceivably benefit oral hygiene, there have been few attempts to evaluate properties in vivo. Also, the cross-sectional study recorded the oral hygiene and gingival health of adult Ghanaians who use chewing sticks, toothbrushes, or a combination of both for tooth cleaning. Plaque and gingivitis scores were higher in the chewing stick users, although these were primarily due to differences in men. Men had poorer oral hygiene and gingival health than women, irrespective of the oral hygiene regimen. The antimicrobial substances contained in chewing sticks appear to provide no additional benefits to those produced by the antimicrobial activities of commercially available toothpastes. The big question. Well, the effectiveness of miswak has always been questioned. Many studies have been conducted to see whether using a miswak is effective in preventing periodontal diseases or not. In an information provided by Sarah Samuel Abduraisi of Riyadh Elm University in U.S. National Library of Medicine article, several clinical studies have confirmed that the mechanical and chemical cleansing efficiency of miswak chewing sticks are equal and at times greater than that of the toothbrush. This was mentioned and revealed that it is in fact right, but only when used in a regular, constant manner with a proper and effective way of plaque removal. There is also a lot of controversy whether the miswak alone can be used for effective plaque removal and good gingival health, or should it only be used as an adjunct to toothbrushing. Although you might find miswak useful when it comes to your oral hygiene maintenance, but to claim that miswak is the best thing to use for your dental hygiene is a bit of an exaggeration. More researches are still being carried out today about miswak versus toothbrush, which leads to an answer of 50-50, no definite answer. So it is best to talk with your dentist before deciding to switch any of your oral hygiene practices. Let me know your thoughts in the comment section below. Don't forget to give this video a massive thumbs up and please hit the subscribe button if you are just coming across this channel for the first time. Cheers to a healthy life, besties. Bye bye.